Okay, it's July 12th, right?
12th of July.
12th of July, 2008. We're coming from Oklahoma City. We're in Dr. Hagglund's office, and my name is Dennis Richard. Dr. Hagglund's been kind enough to allow me to videotape him and share some insight as to some of the things he's been able to do. That's quite amazing. One of the only two doctors I've ever talked to that feel they've been very successful with Lyme's disease, and I'm getting people call me every day to ask questions about Lyme's. It's becoming more and more, I suppose it's becoming epidemic, really, because 2 or 3 years ago you'd hear of somebody maybe once a year with Lyme's. Now I'm hearing of somebody almost daily that have Lyme's, and that's what they've been diagnosed as. And like I said, a few years ago it was like an unheard of thing. I think probably it's been more prevalent all along. It's just that it hadn't been properly diagnosed in the fact, and one of the things we were talking about earlier, that doctors give names to things that not necessarily fit that. It's just it's a way of describing, okay, you have a problem, this is what we think it is, this is going to be the treatment protocol. Is that correct?
That's pretty much it. Lyme's disease has had 2 or 3 inherent problems. One is that the early tests for it were pretty faulty, and then they sort of amped up the test and called something called the Western blot test, and because the symptoms were so large and across a big sort of rainbow of complaints, most of the true orthodox infectious disease doctors say, well, we have no evidence that this is Lyme's disease. It could be several other things. So I think the diagnosis was missed for a long time, to explain what you're saying. And then they had to admit that their blood test wasn't very good, and they came up with something called the Western blot test, and a lot of Lyme's patients get missed because they get a tick bite and they have some symptoms. The typical thing you'd want to see is a target lesion, and then some achiness, and then a relief of symptoms for 2 or 3 weeks, and then the thing sets in again and starts going like really bad. But be that as it may, it turns out that probably the very best test that's available was developed by a pathologist and a hematologist herself in Florida, and this one actually tests for antibodies to the parts of the tick. Okay, the tick that bit you, and so her success rate is a ton better, and to get that test.
Okay, now I've seen some of the I guess the questions and answers that people fill out to help doctors determine what their problem is, and I mean it's almost endless. I mean there must be 30 or 40 symptoms that would allow them to consider maybe you have Lyme's.
Right.
But they could apply to maybe 30 or 40 other diseases as well.
Yes.
So one of the things we were talking about earlier before we started the video was the fact that a disease really is it's just a name. It's a place to start. It's a requirement by the insurance companies that you have some sort of a diagnosis in order to start a treatment program that they will insure. Am I correct? Did I understand it correctly?
It's very true, and before this becomes sort of a, well, I'm one of the top Lyme's doctors in the country, I wouldn't want to infer that. It's just that it fits a model that I think a lot of patients and even a lot of doctors need to understand, and that is that most patients have got 3 or 4 dysfunctions going on. Let's just call it, instead of disease, just dysfunctions. So if you have a simple upper respiratory infection, that's one thing. You're sneezing and draining. But suppose you have a simple upper respiratory infection and you're 87 years old. Now that's considerably something different. And let's say that you are 87 years old, have an upper respiratory infection, and you're low thyroid, and you have difficulty with insulin and controlling your blood sugar. That's a whole different story. You see, there's just so many more things, one thing overlaying another thing, overlaying another thing. And if patients understood this, and if doctors understood this, I believe that we can uncover one layer, uncover another layer, uncover another layer, and get to a patient who is well instead of what disease did I have, and what was it that I needed, or what was it the other doctors weren't giving me that I should have had. Those questions do not fit the typical medical model that I see today in a country, again, that is so bad as far as its nutrients, its stress, plus its toxins, plus covering up symptoms with drugs when they should have been fixed through physiologic ways and so forth. When I see this sort of scrambled egg problem, or this huge big salad of problems that we have facing our patients, unless they understand that and approach it that way, they're just going to get bounced from specialist to specialist, one CAT scan over to another person who does a special kind of energy adjustment, to a psychiatrist, to an internist, to a sleep apnea program, to an obesity program, to a, back and forth, and you just wander around like a ball falling through one of those little pachinko machines in Japan. It's
right.
And that's happening. It's expensive, and nobody's getting well.
I know that I'm fortunate enough to know Dr. Hitt and Humiston, and they have both explained to me that the underlying cause of, if not all disease, nearly all disease, is harmful pathogens that break down the immune system. And that once you address those, and the harmful pathogens are gone, then the immune system is very much more effective in healing of whatever your problem is. Do you feel that's true?
I understand that very well, and I believe that they are profound in what they're saying. And if you're going to address disease as an immune system that isn't working, that'll be fine. I would like to open the door to a couple of other subjects, though.
Okay.
That if these patients have been exposed to mercury in their teeth and getting fluoride in their water, and they're getting, let's say, corn syrup in their foods, which turns down their thyroid, you see, we have to enlarge what it's going to take to get that patient well again. You got to fix those things. You got to fix the diet, you got to remove the toxicities, and you've got to stay at it. And what's more important is, hopefully patients would learn something simply called patience by understanding this process, that we're now sort of unraveling and taking various things out of the body so that it can do the most wondrous thing that it knows how to do, and that is it heals itself.
Right. I know, to me, that was one of the first things that I learned when I started turning my own health problems around, was that the cleansing, detoxing, getting rid of the things that's broken down the immune system made a huge difference. I followed the Holy Clark's protocol on a liver cleanse, and I filled a quart jar full of liver stones. And within a week, I felt 20, 30 years younger, and I was about 10 pounds lighter. But a quart jar full of stones from a liver cleanse, I stayed on the fast for 6 days. I didn't quite follow her protocol exactly, because she recommends 1 day every 2 weeks, and I just did it 6 days in a row and they were gone. But it was amazing to me, the difference, and it got me really excited in learning more and more about cleansing, detoxing, and alternative health, and that was just the beginning of reversing my health problems.
Well, I know you're deeply committed to this subject, and I know that if you understand why you get gallstones and why you get kidney stones, that would even add more to your understanding of how you get well. And you precipitate out those stones in your liver, and you precipitate those out in your kidneys if you don't have enough magnesium, and or if you're in a constant acidic state. Okay? So we can always go one layer down, and I know Dr. Clark knows about this.
Right.
But at the same time, once our practitioners and our doctors, and now the public begins to understand that, look, you can always get to the root of the tree and fix it, fertilize it, change the soil, then guess what? The trunk gets stronger and the leaves fall off and new ones come on, new healthy ones.
Right.
But if you're a tree, you got a tree in your house, in your backyard, and it looks bad, and you go out and just cut off the dead limbs.
Right.
And that's what I tell most of my patients. This is what's happening when you go and get a high blood pressure medicine. Well, this is what's happening when you go and get a diabetes medicine. Or this is what happens when you go and get an arthritis medicine. You're just fixing the wrong part of the tree. You have to go down in the roots, fix those. The tree then fixes itself.